Class we will learn about the homeostasis, osmoregulation, and blood clotting in relation to the animals is concerned, with a special emphasis on the animals. So, osmoregulation balances uptake and loss of water solutes is a based on a largely controlled movement of solutes between the internal fluids and the external environmental. And this is always regulated by many of the parameters starting from the absorption of the fluids, excretion and retention of the nitrogenous metabolites and many substances which regulate the osmolality. And there are two terms like osmosis and osmolarity. So the cell requires the balance between the uptake and loss of water always, or else there will be a dehydration of the cells take place. That's why the term osmolarity, the solution concentration of a solution, determines the movement of water across a selectively permeable membrane. And if two solutes are isoosmotic in nature, the movement of water is equal in both directions. So, if two solutions differ in osmolarity, the net flow of the water is from hypoosmotic, means lesser osmotic, to more osmotic nature. So this is one of the example here. It is given there is a net water flow will be in this direction, and there are solutes are there, and this is the water which is depicted in blue color. So this is the hyperosmotic side, and this is the hypoosmotic side. Suppose if you go on adding more and more this solutes concentration, then the net water flow will be towards the hyperosmotic sides, and the higher solute concentration will be there in the hyperosmotic side, and lower free H2O concentration will be present there. Whereas the hypoosmotic side, the higher free water concentration will be present. And there are a lot of changes like called as the osmotic changes are there. Then these are also called as the osmoconformers, consisting only of some marine materials which are osmotic with their surroundings. For example, which do not regulate their osmolality. For example, many marine invertebrates which are living in the water do not lose the osmotic balance, even though the external water is a lot of salt. Whereas osmoregulators expand the energy to control water uptake and loss in a hypoosmotic or hypoosmotic environment. The marine invertebrates and some invertebrates do contain this type of the natures. For example, a marine fish, here is the photo of a marine fish which gain water and salt ions from the food, and also gain water and salt ions from drinking salt water. So always it will excrete the salt ions from the gills, and also the osmotic water lost through gills and other parts of the body. Hence, the net excretion of salt ions and small amounts of the water in scanty urine from the kidneys will maintain the osmoregulation of the marine fish. Here, the two important key factors are water and salt. So both of this will going to balance the osmoregulation in a marine fish so that it will not shrink in size. So the freshwater animals, there is always opposite action. For example, in the marine fish, gain of water and salt ions from the food will be there always. Whereas similar type of the excretion of salt ions and also osmotic water through gills will be present, and excretion of salt ions and small amount of the water will be present in the urine of kidneys. Whereas the fresh marine animals always take in water by osmosis from hypoosmotic environment, because the salt concentration in the fresh water or sweet water, what you say, is less, and lose salts by diffusion and maintain water balance by excreting large amount of dilute urine, and salts lost by diffusion are replaced with food and by uptake across the gills. So this is the mechanism of osmoregulation in a freshwater fish. So what it does, there will be intake of water and salt, which are the two key factors in this condition, and there will be a gain of water and some ions in the food through the mouth. At the same time, the uptake of salt ions by the gills. See here, the uptake of salt ions molecules and osmotic water gain through gills and other part of the body. This is exactly opposite to that of the marine water, whereas these are going to excrete large quantity of the water in dilute urine with very lesser content of the salts. So this is exactly opposite to that of the seawater fish. Hence, the seawater fish cannot survive in the marine environment, and the marine water, no, then the marine water fish cannot survive in fresh water because of the osmotic changes. Whereas the land animals, the mechanism is totally different. Body coverings of most of the terrestrial animals are in such a way that it more of the help prevent the dehydration, and the balance of the water and electrolyte is a little complex matter than that of the fish, etc. Etc. Then uh, the they are going to be balanced by the kidney, lungs, and skin, etc., through the cellular respiration. Then here you can see there is a water gain and water loss. Both are there in the, for example, in a rat, it's a called as kangaroo rat, and in a human beings who drink the water of 2500 ml or 2.5 liters per day average. So what is the difference between these two animals is, suppose the small animal which ingests the water to the extent of 2 ml per day, then there will be ingested water through the food is zero point 0.2 ml only, whereas the derived water from the metabolism in the body will be about 1.8 ml. That means more water will be present already in the body, and a small quantity of the water will be present in the body, and the later this will be balanced by the cellular metabolism. So for example, in case of human beings, the ingested water through the food is 750 ml, whereas an average human being will drink a water in the form of the liquid to the extent of 1.5 liter, and derived from the metabolism it is very less, especially in case of the larger mammals. So totally it is going to come to the extent of 2500 ml per day. So what is the water loss? This is the gain. So what is the water loss? For example, in a this especially in case of the man will take it first, it is 100 ml per day through the feces. Urine is going to produce the urine what he drinks exactly in a per day, and evaporation through the body through the production of the sweat, etc. It's about 900 ml, and also through the expiration or exhalation or the respiration. So here in case of these small creatures, it will be very less, 0.09, or what we can say it is as this approximately it is 1 zero point 0.1 ml, whereas the urine through it is 0.45 ml. Evaporation is about 1.46 ml. So this is the way the body balances the water in its body. So the body balances by the osmolarity, and energetics of the osmoregulation is must depend upon the energy to maintain osmotic gradients, and the amount of energy differs based on how different the animal's osmolarity is from its surroundings. So, for example, the osmolarity or osmoregulation of an animal's body is depending upon the temperature of the environment, the diet the animal has consumed, the quantity of the water it has taken inside the body, maybe through the food or also through direct liquids, and also the excretion status of that particular animal, and the work required to pump solutes across the membrane. This is also another criteria. Many people say that drink more water, you will be very healthy, but that's also not good for the body, because the body has to invest more and more energy to pump the water out continuously. So, the transport epithelia in osmoregulation is the epithelial cells that are specialized for moving solutes in specific directions. So, they are typically arranged in complex tubular networks. For example, the nasal glands, especially in case of the marine birds, which remove excess sodium chloride from the food, blood. So they always secrete some discharge from the nares, which contain more and more salty content. Whereas this is the nasal salt gland, which is just above the eye. For example, in case of a bill, nostril with salt secretions, ultimately they are going to secrete the salt. So more and more salt they are going to secrete, and also the blood flow will be in such a way that there will be a central duct, and there will be the capillary blood and arterial and veins. So there will be secretory cells that transport the epithelium, and blood flow will always put the salts out, and they will accumulate and come out of the nostril with salt secretion. So this is the mechanism, and animal nitrogenous waste reflects this phylogeny and habitat. So the nitrogenous waste end product is ammonia, and the breakdown products of the proteins and nucleic acid. So the animals convert the toxic ammonia to less toxic compounds prior to the excretion from the body. For example, the proteins are broken down into amino acids and the NH2 groups, amino groups, and most aquatic animals, including most bony fishes, they excrete the ammonia directly through the secretion produced as ammonia. Whereas in case of mammals and most of the amphibians, sharks, and some bony fishes do convert the NH2 containing amino acids to form the urea. This is the formula of urea: O double bond C, NH2 and NH2. Whereas most of the reptiles, including the birds, insects, and the snails, they convert the amine containing amino acids to form the uric acid as the end product. And you might have seen the dropping of the bird, which is containing the white part, etc., which is a uric acid. Whereas the mammal's urine is more diluted, whereas the uric acid containing is more concentrated in nature, especially of the birds. And forms of the nitrogenous wastes are in the form of the ammonia, this one, then urea, and also the uric acid. And these differ in toxicity and energy costs of producing them. And ammonia, most of the animals that excrete the nitrogenous wastes as ammonia, which need access to lots of water. Hence, they release ammonia across the whole body surface through the gills. So they have got a special organ known as the gills, through which the water flows continuously, and there will be exchange mechanism of the water, the waste substances in the form of the ammonia, and also in the form of the nitrates. And urea is excreted through the urine of most of the mammals, and the adult amphibians converts ammonia to less toxic urea. The circulatory system carries urea to the kidneys where it is excreted, and conversion of ammonia to urea is energetically it is expensive. So excretion of urea requires less water than that of the ammonia because urea is one of the most water soluble substance and requires very less energy for its excretion. Whereas the uric acid is produced by many of the insects. See, this is very interesting thing. The snails which are traveling in the waterlogged areas, and many reptiles like the snakes, birds, they excrete uric acid in the form of the waste of the protein. And uric acid is relatively non-toxic and does not dissolve readily in water. That's why the white droplings of the birds will be like that. And it can be secreted as a paste with little water loss. And uric acid is more energetically expensive to produce than that of the urea. Then excretory process is mainly consisting of the kidneys in most of the domestic animal by creating a filtrate derived from the body fluids. For example, the filtration is simple filtering up of the body fluids, whereas the reabsorption, reclaiming valuable solutes, secretion is adding non-essential solutes, waste from the body fluids to the concentrated filtrates, whereas the excretion is end step, and all these materials which are not required to the body need to be excreted out of the body, which becomes the very good nitrogenous material, and later it's very useful to the land to maintain its fertility. That's why this is a very good change. The excretory products of the animals become the nitrogenous fertilizer to the plants, and the plants are eaten by the herbivores, and later herbivores are eaten by the carnivores. Like this biological cycle continues. See, this type of the capillary system through the filtration in the form of the renal tubules or in the developed mammals. Here you can see the filtration. The capillary beds will be surrounded, and most of the time they are filtered through the filter. Then this process, the filtered material is called as the filtrate, and many times there is reabsorption takes place, which is once again to the capillary, and finally the excretion secretion process takes place from the capillary directly to the collecting duct, etc. Then it forms a urine, and finally it gets excreted in the body. So there are called as the Malphagium tubules in insects and other terrestrial arthropods. Malphagian tubules remove nitrogenous waste from the hemolymph and function in the osmoregulation. So these insects produce a relatively dry waste matter, mainly uric acid, an important adaptation to the terrestrial life. And some terrestrial insects can also take up water from the air. And this is one of the photographs which shows the digestive system of any type of the insect like the grasshoppers. For example, this is the digestive tract which contains the midgut, and this is called as the Malphagian tubules, and the end part is rectum, then hindgut. So the midgut is also called as the stomach. Then in the particular type of the midgut is expanded here. Then the salt, water, and nitrogenous waste are the excreted through these Malpighian tubules. So the hemolymph is one of the substance very similar to that of the blood in case of the developed animals. And whereas the feces and urine will be stored in the rectum, and later ultimately they will be passed through the anus, which is a regular process in most of the animals. Whereas the kidneys are the developed organs, excretory organs of almost all the vertebrates, function in both excretion and also in case of the osmoregulation. And these are all the kidneys which are present on both sides of the body of almost all the animals, and there will be the right and left kidneys in case of human beings, and it is a very common trend in case of all the vertebrates. For example, there will be a posterior vena cava is the collecting one, and from the renal artery is the one which supplies the blood to the kidneys continuously through the aorta branch, and finally the urine is formed in the kidneys, both the kidneys, and collected in the urinary bladder and is excreted later through the excretory organs. And the kidney structure, already we know that the upper or this outer coat is called as the renal cortex, and in between it's renal medulla. Then the blood supply is from renal artery, whereas the renal vein is the one which carries the impure blood from the kidney, and the ureter is the one which transports the urine formed to the urinary bladder. Whereas if you take up this renal cortex and magnify it, the unit of the nephrons are called as the unit of the basic units of the kidney cells are called as nephrons, which do always contains renal cortex and renal medulla, and the cortical nephron and juxtamedullary nephron, and ultimately there will be the collecting duct, and urine is formed in this area, will be collected through the ureter inside the bladder and excreted through the urethra. Then this is the nephron organization. It is a complex organization, and we have to study the structure in such a way that the urine is formed by a this Bowman's capsule by the entry of afferent arteriole of the tubule of artery. This enters and comes out of the efferent arteriole of the glomerulus. Then once again it surrounds throughout the branch of this descending loop and ascending loop of the Henle, and the proximal convoluted tubule and peritubular capillaries are surrounding the different parts of the tubules, the collecting ducts, etc. So here, with lot of pressure, the fluid is formed into the filtrate, and it is circulated through the afferent duct, descending gleam, etc. Then finally, the especially the urine will be formed. See here, you can this is going out in such a way that the filtrate will go into the proximal tubule, then it enters the peritubule, this enters the distal tubule, then descending gleam, and once again this is the ascending gleam. Then later it is going to end up in the glomerulus once again, and forms the distal collecting tubule. Then it flows into the collecting duct. Later it is excreted as urine. So this is the entire structure is called as the loop of Henle. And this is the one structure how we are using the different type of the diuretics and blood vessels from a human kidney. So here you can see the arterioles and peritubular capillaries appears in the pink, and glomeruli appear yellow. So this is entire structure of the nephron organization. And the nephron is organized for stepwise processing of blood filtrate. Initially, the filtrate produced in the Bowman's capsule to contain almost all the salts, glucose, even including the essential amino acids, vitamins, nitrogenous wastes, and other small water molecules. And the filtrate fast through the proximal tubule. Here, the proximal tubule is initially produced by the a closer. Then the reabsorptions of the required ions, water, and nutrients takes place in the proximal tubule. Then molecules are transported and actively and passively from filtrate into the interstitial fluid and then the capillaries into the distal. Some toxic materials are actively secreted into the culture filtrate. As the filtrate passes through the proximal tubule, materials to be excreted become very, very concentrated. So this is one of the important step in case of the proximal tubule. So here in the bonus capsule which is present in the kidney cortex, then bicarbonate ions are coming out and sodium chloride, water, nutrients, potassium and the hydrogen and ammonia enter from the outside. Whereas the loop of Henle, this is the descending loop of Henle, and ascending loop, the sodium chloride will be excreted out, and distal tubule, once again, the sodium chloride, hydrogen oxide or the water bicarbonate ions, then the potassium and hydrogen are coming inside, and net total the in spite of that thing, finally, the active transport of the sodium chloride takes place, and the collecting duct ultimately will contain the water and urea and other unwanted materials as the components of the urine. And descending limb of the Henle is ascending and descending. So the movement is driven by high osmolality of the interstitial fluid. So the filtrate becomes increasingly concentrated here. More and more, the absorption takes place. And ascending loop of the Henle, in the ascending limb, the loop of Henle, salt but not water, is able to diffuse from tubule into the interstitial fluid. That's why the filtrate becomes increasingly diluted, whereas the water is retained, whereas the salt is getting out by the active transport. Whereas the distal convoluted tubules regulate potassium and sodium ion concentrations in the body fluids. So, the controlled movement of the ions contributes to the pH regulation in the body. Whereas in case of the mammals that inhabit environment with dry weather have long loops of the Henle, while those in the fresh water have relatively short loops because they need not waste any water. Whereas the birds and other reptiles always do contain the cortical nephrons, but also excrete nitrogenous waste as the uric acid. And whereas the freshwater fishes and amphibians do conserve salt in their distal tubule and excrete large volume of the very dilute urine, whereas it contains very low concentration of the sodium chloride, and kidney function in amphibians is similar to that of the freshwater fishes, which are doing this process by the gills. And amphibians conserve water on land by reabsorbing water from the urinary bladder. And marine bony fishes always having the hypoosmotic, especially with their environment. Their kidneys have very small glomeruli and some lack glomerular entirely. So the filtration rates are very low and very little quantity of the urine is excreted. Even though it is excreted, it is very much concentrated. So the hormonal circuits link kidney function, water balance, and blood pressure is the anti-diuretic hormone, or it's also called as the ADH, which makes the collecting duct epithelium more permeable to the water. An increase in osmolarity triggers the release of anti-diuretic hormone, which helps to conserve water. So the mutation in ADH production causes the severe dehydration. and results in diabetes insipidus. That's one of the disease. And alcohol is a diuretic that inhibits the release of the anti-diuretic hormone. Then here you can see there is a difference between animals, especially inflow and outflow of this urine. So freshwater fish lives in water less concentrated than that of the body fluids. Then fish tends to gain water and lost salt, whereas the salt does not drink water salt in hydrogen oxide or the water active transport by the gills takes place in case of such animals. So these animals do produce large volume of the with very less salt content and then that of the body fluid. So the marine fishes, they live in water more concentrated than that of the body fluids. But how they maintain the osmolality is they lose more water, gain salt through drinking water. And the salt inside and salt out are almost same and H2O out. And they produce very small quantity of the urine and urine is containing slightly less concentrated than that of the body fluid. Ultimately, the osmolarity of the body is maintained in such a way that the fish can survive in that environment which contains very high quantity of the salt outside. Whereas the human is having a different type of the uh, balancing system because he is a terrestrial vertebrate and terrestrial environment tends to lose body water to air through several means through the urine this water and salt will be getting out and the drinking water will always contain many type of the salts which will be taken by the mouth and excreted through the urine and the urine is moderate volume will be present. For example, if an adult human being drinks about 1.5 liter of the water per day and the exact quantity will be produced by the body as urine. So urine is more concentrated than that of the body fluids. That's the things. And the this I mean this is about the osmoregulation, how the animals do maintain the body fluids. And now let us study what is the definition of hemostasis. That's the homeostasis. This is hemostasis. Hemo means blood, stasis means clotting. So it occurs in three stages. Number one, vasoconstriction. Number two, the platelet leg plug formation. The three is coagulation of the blood. So these are the three forms how the body will not lose the blood even after damage to the capillary endothelial system or capillary walls. So the number one process whenever there is a wound etc., the blood vessel constricts immediately and decreases the loss of the blood from the damaged portion, whereas the arterioles and veins, which are very very small, will participate purely on the local phenomena. And whenever the blood vessels are cut, the endothelium is damaged and the collagen is getting exposed to the air and the platelets adhere to this collagen get activated. So the platelets get activated to by the local effect and the activated platelets secrete the serotonin and other vasoconstrictor substances which are having the different actions which cause constriction of the blood vessels and also adherence of the platelets to the collagen is accelerated by van der Waals factor. So this factor acts as a bridge between specific glycoprotein present in the surface of platelet and also the collagen fibrils. So this is for first one, the vasoconstriction, whereas the second one is platelet plug formation. So this is a plug which is going to prevent the further blood loss, which is uh, going to be under the influence of adenosine diphosphate and thromboxane A2. And these two substances attract more and more platelets in a wounded area, then all these platelets suddenly they aggregate together and form a loose temporary platelet plug or temporary hemostatic plug. And this loosens the ruptured vessel and prevents the further blood loss. And this platelet activating factor is the one which is responsible for platelet aggregation whenever there is a cut wound and bleeding. And third one is the coagulation of the blood. And there are a lot of factors are involved here. The fibrinogen need to be converted to fibrin, and fibrin threads get attached to the loose platelet plugs. Then this block the rupture part of the blood vessels and prevent the further blood loss. And final mechanism. And mechanism of blood clotting is explained especially like this. So whenever there is an injury to the blood vessel and damage to the endothelial system, immediate exposure of the collagen to the air will happen, and due to the van der Waals factor, there will be adherence of platelets to the collagen. The collagen fiber get attached to the collagen fibers especially. The force behind this one is the van der Waals force, and these are going to activation of platelets, which secrete the serotonin, the local hormone, or the vasoconstrictor substance. Then this is called as the stage one. Immediately they are going to cause the vasoconstriction, the release of local serotonin, then secretion of this adenosine phosphate and thromboxane A2 is going to activate the platelet activating factor, and this is going to cause the aggregation of the platelets, and ultimately platelet plug formation will happen. This is called as the stage 2 in blood clotting, whereas the finally the prothrombin activator formation will be there, and ultimately the blood clotting will happen in three stages like stage 1, stage 2, and also stage 3. Then this is the beginning of the vessel damage, then altered endothelial surface, where in which the collagen fibers get exposed outside environment, and immediately the activation of the platelets takes place by activation of the platelets that aggregation and discharge of the mediators like serotonin. Then chemical mediators are going to contract the blood vessel, and ultimately vasoconstriction happens. Whereas the synthesis of thromboxane A2 is further going to support this process, and a platelet plug or white plug will be formed by its own, and coagulation of the blood takes place as a the subsequent mechanism. So coagulation or clotting is defined as the process in which the blood loses its fluidity and becomes a jelly-like mass within few minutes after it is shed out or collected in a container. So this happens by several pathways, and in different animal the blood clotting time is different. For example, in case of the human, it is 8 to 11 minutes, whereas in other animals also it is depending upon the species. See, the factors involved in blood clotting, it's a cascade of reactions. Activation of group of these substances. So substances necessary for clotting are called as the clotting factors. So whenever there is a rupture up of the capillary, there will be formation of the plug due to several steps as explained earlier. So the clotting factors you can see from starting from fibrinogen is also called as factor 1, then prothrombin 2, tissue factor 3, calcium 4, then the other levine factor or AC globulin is called as the factor 7, then factor uh, 5 and 7, serum prothrombin conversion, then accelerator and proconvertin, then also the stable factors will be produced. Whereas the factor number 8 is anti hemophilic factors, and it is the steps continue to factor 9, factor 10, 11, 12, 13, then ultimately the pre-callicrins are formed. These are also called as the Fletcher factors, and the factor number 8 is also called as fibrin stabilizing factor, and the factor number 7 is called as the Hageman's factor. And high molecular weight kininogens uh, will form the platelet aggregation. So here it is depicted in the diagrammatic or pictorial format, like the one is a severe blood vessels, and immediately there will be the formation of the platelet aggregations will be formed, and the third step is the fibrinogen appearance will be present, or exposure will be present inside the environment, and immediately the fibrin clots will be formed, then clot reaction occurs. So this is taken by Elsewhere and Guyton's Veterinary Physiology textbook of medical physiology, 11th edition. Then here the blood vessels, the prostaglandin I2s are also there. They are also going to constrict the blood vessels apart from the nitric oxide. Then there is thromboxane A2 is there to have the collagen fibers outside the cell to form the platelet plug in the damaged area, so that a clot will be formed which prevents the further blood loss. Then enzyme cascade theory is the stages of the blood clotting will also be uh, like three factors: one, formation of prothrombin activator, then conversion of prothrombin into thrombin, then conversion of fibrinogen into the fibrin. Whereas the stage 1 is formation of prothrombin by several cascade of events, or the production of prothrombin activator. So this converts prothrombin to thrombin. Thus, formation of the prothrombin activator occurs through two pathways. One is intrinsic, another one is extrinsic pathways. So this is the stage 2 conversion of prothrombin into the thrombin, which is more stable agent. And blood clotting is all about the thrombin formation only. Once thrombin is formed, it is definitely lead to the clot formation. Whereas the stage 3, this is the conversion of fibrinogen to the fibrin by the catalytic activity by interference of certain enzymes. So this is the final stage of the blood clotting, which involves the conversion of fibrinogen into fibrin by the thrombin. So this is the chart which in detail explain the different stages of the blood clot. Number one, the intrinsic pathway and extrinsic pathways, they involve in the blood clotting, wherein which several factors are being converted from one to another, and in which the final product is the thrombin formation. And the, for example, the platelets combined with that of the phospholipid, ultimately they are activating the prothrombin activator, and the prothrombin activator is going to stimulate the thrombin to convert the fibrinogen to fibrinogen A. Then the polymerization takes place, loose strands of the fibrin, and ultimately fibrin tight blood clot will be formed by both extrinsic and intrinsic pathways. Then there is a activation of the glycoprotein phospholipids, 7 in the presence of calcium, etc. So they are going to prevent the very important damaging process, that's the blood loss, and try to retain the blood as much as possible, even with adverse situation also. Apart from this one, the liver synthesizes the bile salts, and bile salts are present in bile, and the GI absorbs the naturally the vitamin K, and the increased quantity of the vitamin K is going to synthesize the clotting factors, and clotting factors are the one which are important steps to formation of the clot. Hence, the administration of the vitamin K and also the C and calcium will definitely help the animal to get the bleeding disorder retained to normal very early. This is nothing to do with that of any cardiovascular system. So after formation of the blood clot, it start contracting. About 30 to 45 minutes, the straw colored serum oozes out of the clot. The process involving the concentration of blood clot and oozing up of the serum is called as the clot retraction process. The contractile proteins, namely the actin, myosin, and thrombostatin in the cytoplasm of the platelets, and these are very, very important and responsible for the clot formation. Then the fibrinolysis takes place. This clot cannot be stayed in the capillary for longer time. It has to get lysed. So the lysis of that particular blood clot, which has happened the animal in emergency, will need to be lysed. So the fibrinolysis is also once again done by the different type of the chemical mediator, and there is a substance involved is called as the plasmin or fibrinolysin. Plasmin or fibrinolysin. So anti-clotting mechanism in the body is the one always try to retain the blood inside the body, but in spite of that thing, sometimes it fails. But as a delayed response, there will be continuous circulation of the blood to the organs, whereas the number two is smooth endothelial lining of the blood vessels are formed. Whereas the chemical factors, normal anticoagulants, presence of this natural anticoagulants called as the heparin, that is produced by the liver. So this production of thrombomodulin by endothelium of the blood vessels except in brain capillaries. So there will be thrombomodulin is a thrombin binding protein. So this binds to thrombin and forms a thrombomodulin plus thrombin complex. And ultimately this activates the protein C, and the activated protein C is along with the cofactor protein S inactivates factor 5 and factor 8, and inactivation of these two clotting factors prevents the clot formation. And ultimately, all clotting factors need to be get inactivated and get inside the body once their process is over. So some of the anticoagulant agents like the heparin and also the coumadin or coumarin, it's also called as the warfarin, and also some of the drugs like rivaroxaban and dabigatran or apixaban, or all are the anticoagulant in nature. And apart from this one, few more things are need to be dealt, just like the common and these antiplates in the body. They include the clopidogrel and ticagrelor are the drugs. Then applied physiology, bleeding disorders will be present like hemophilia, purpurea, then van der Waals diseases, where with these organs get saturated and unable to cope up with the body. Then hemophilia is a group of sex-linked inherited blood disorder characterized by prolonged clotting time. It's genetic in case of the human beings also, but the veterinary or the animals which are belonging to the animal kingdom do also have the blood in their body, and everyone has to check what is my blood components, etc. That's why the coagulation time is little prolonged, because multiple factors are involved, and the formation of prothrombin activator is affected due to the deficiency of factor 8, 9, and 11. So the hemophilia, of course, it's less in case of the animals, but hemophilia is a deficiency of factor 8, and 80% of the people with hemophilia are affected by hemophilia A type of hemophilia. Whereas hemophilia B is also called as the Christmas disease, because due to the deficiency of factor 9, and 15% of the people with hemophilia are affected by hemophilia B type. It's also called as the Christmas disease. We do not know why it's called as, but the hemophilia C to factor 11 deficiency, due to the deficiency of factor 11, it's a very rare bleeding disorder, especially hemophilia. So, what are all the symptoms of the hemophilia? Means continuous bleeding from all the orifices of the body, and the line of treatment of hemophilia is simple, and it is effective therapy for classical hemophilia involves the replacement of missing clotting factors from other animals' blood, and the purpura is disorder characterized by prolonged bleeding time. However, the clotting time is normal. Bleeding time will be more. So while in the coagulant drugs, we need to be little careful, because the cascade of events does not permit us to use any type of the drugs which is non-specific in nature. So sometimes the hemorrhagic spots are also found inside the beneath the skin, and purpuric spots as the clinical signs of this purpureal disease. Then coagulation of the blood takes immediately after the formation of the clot. For example, clotting factors, already we know that varieties of the clotting factors are there, starting from factor 3 to factor 12, and these are going to have the formation of the plug to prevent the blood loss. So the clot factors, there are about 13 clot factors are existing inside the body of a human being, and we do not know how their presence. So the tissue damage will release blood vessel sperm, then platelet plug formation, then clotting actor mechanism, then prothrombin activator, then prothrombin to thrombin formation. Ultimately, the fibrinogen is converted to fibrin and blood formation will be happen. So the stages of blood clotting already we know that ultimately it need to be converted to fibrinogen into fiber by the platelet activating factors. So the intrinsic pathway and extrinsic pathways are explained already. Then this is the extrinsic pathway which converts glycoprotein phospholipid to with that of the calcium and thrombin. Whereas the intrinsic pathway involves the clotting uh, factors. Then the stage 2, it's also called as conversion of prothrombin to thrombin. Then the prothrombin is converted to the thrombin here. Then the stage 3 is conversion of fibrinogen into fibrin. Here, fibrinogen to fibrin is converted under different clotting factor with that of the calcium. Whereas the stages of blood clotting is continuous, and prothrombin A activators are converted to prothrombin into thrombin, and ultimately this is converting the fibrinogen into the fibrin. And there will be the substances like blood clot retraction, then also fibrinolysis once the process is over. Then several pathways are involved. One is the intrinsic pathway, then another one is the extrinsic pathways. So the prothrombin is converted to thrombin, and the subsequent mechanisms, as you know very well. Then clotting and fibrinolysis are the steps which are present in the formation of the thrombosis, and also another one is the bleeding opposite. So fibrinogen is converted to fibrin, and the formation of clot will happen, and ultimately the bleeding is going to cause. And anticoagulants are the drugs which prevent the clotting mechanism inside the body. So these are used as therapeutic agents to prevent the clotting of blood vessel that is collected in the body. That's in case of in vitro. Whereas anticoagulants are going to act in vivo, and anticoagulants used to prevent blood clotting both in vivo and in vitro. This is the one of the thing is the heparin. It is produced by mast cells and also the basophils. We know that this is going to inhibit the clotting factor, and it removes the thrombin, and no blood clotting will be formed, and activates the antithrombin 2 to inactivates all the clotting factors. So ultimately, this is the cascade of events preventing the formation of the clot and also prevention of blood clotting. Then heparin is widely used as anticoagulant in blood transportation, blood transfusion, etc. Dose of this heparin is zero point 0.1 to zero point 0.2 milligram is sufficient for 1 microliter of blood. It is effective for 8 to 12 hours. This you need to remember. And coumarin derivatives like the warfarin and comodine, etc., are used to prevent the myocardial infarction, heart attack, strokes, and thrombosis. then EDTA, then ethylamine, ethylene diamine tetraacetic acid is a very commonly used anticoagulant drug which enact available in two forms, disodium salt or sodium disodium EDTA and tripotassium salt like K3DTA. And these substance prevent the blood clotting by the removing the calcium from the blood, especially the EDTA. Calcium is very much required for the blood clotting. Then oxalate compounds are also useful in case of the prevention of the blood clotting like calcium oxalate, etc. Then citrates are also used for prevention of the clotting. Sodium, ammonium, and potassium citrates are going to be used. So these combined with the once again the same calcium in the blood to form insoluble calcium citrate and the like oxalate citrate also remove the calcium from the blood and the lack of calcium prevents the coagulation. So the blood clotting time can be estimated by bleeding time, clotting time, prothrombin time, partial prothrombin time, and international normalized ratio, and ultimately the thrombin times. So there are a lot of bleeding disorders: hemophilia, purpurea, von Brand disease. So this is like the injury, then 24 hours it has to go to heal, then 27 hours the inflammation starts, and 48 hours no scab will be left, ultimately it will be removed. And sometimes the bleeding will be stopped by putting the ligatures or also sutures. This is the disease called as the purpura, where in which the beneath the skin there is accumulation of the blood capillary substances or hemoglobin, etc. And this need to be taken very cases when Vanderbilt disease and also sometimes the nasal bleeding will be seen whenever the platelet deficiencies will be present. And thrombosis is a complication of thrombosis or thrombus formation, embolus and embolism, then ischemia, then necrosis and infarction, myocardial infarction will happen. And that's about the topic, blood clotting, etc. Thanks a lot for patience.